Good afternoon. I'm David Baiada, the CEO here at Baiada Home Healthcare, and today is Friday, September 11th, and this is your weekly CEO update during the coronavirus pandemic. I want to kick us off before getting into some recognition of some great work out in the field, as I usually do to send us off into the weekend. Kick us off with Nora Triola, as usual, to give us an update on some of the key things that we're doing to make sure we adapt appropriately during this continued chaos of the pandemic. Nora?
Thanks, David. And it's again a pleasure to be with you and to share some important messages. As you know, we've gone to adding eye protection to your daily routine. And we've done that based on data so that we make sure that both your mouth, your nose, and now your eyes are covered so that you are not exposed. And what's sort of come to our awareness is that perhaps you don't always understand what we do when we ask you to report any kind of exposure or any employee or client that you come in contact with who may be developing and demonstrating symptoms. And that's really so that we can keep you safe at all times. We have a big database, and as you report that information to your director, he or she actually puts that into a large database that then allows us to keep you safe, so that when there is a client that's positive or an employee who was exposed and then may come up positive with COVID-19, we can make sure that we do the contact tracing and that we know who to contact and advise you individually about your risks and how to quarantine yourself and keep yourself safe. And so it's really, really important not only that you wear your surgical mask and your eye covering, but also that when you come in contact with somebody, a client or an employee who's had an exposure or a case that you know of, that somebody tested positive, or even when they're waiting for the testing results, it's important for us to know that so that we can put that in the database and that we can then keep you safe, do contact tracing when we need to individually work on the specifics of those exposures and keep them contained, so that if somebody does end up exposing another, that it's limited and not something that goes on that we could have prevented. Our whole goal in this is to keep you and our clients safe and continuing to deliver that exceptional service and high quality care that you have just done amazingly well with during this period of uncertainty. And so just a couple of reminders and the why behind the importance of letting your directors know when in fact you've got somebody that is testing positive or that's got symptoms, and consulting with the team in the office. So thanks for all you do and keep up the good work. And I'll turn it back to David now.
Thanks, Nora. I just want to reiterate and underscore the sort of connection and then between our decision-making and judgment about how to get the right safety protocol in place and its dependency on getting real-time information from all of you out in the field, and recognize Nora and her team, because what they're doing is taking this data and crunching it literally every day to figure out what's the impact of these adjustments on our infection results or our safety protocol, and making adjustments in real time. And it's really, really important because things are moving fast, right? We're getting new information every day. And so these aren't like reports that are going in a file in some drawer just so that we have them. This is information that you're contributing to help Nora and myself make good decisions daily. And we can't make decisions about things like protocol or policy change or safety interventions unless we have information as fast to real time as possible. And that's what this is all about. And so thanks for helping us and giving us the information we need to make good decisions to help keep you and our clients safe. As usual, I want to send us into the weekend with an amazing story of a Baiada nurse in Rhode Island, our skilled nursing office in Providence. This is Jen Burgo, who was the RN hero of the quarter up in Rhode Island. And this photo was submitted as part of her nomination. You can see her geared up with eye protection and her surgical mask, but also adding a little bit of flair to her surgical mask to create a sense of safety and trust and a little bit of fun with her client there in the photo. So thank you, Jen, for everything you do to navigate even what a scary eye protection protocol might be perceived for your client and make it a little bit more fun and interesting to create a sense of connection with your clients. But thanks to each and every one of you, because I know you're all finding creative ways to navigate all of this complexity to keep yourself and keep your clients safe during this incredibly challenging time. Thank you. Have a great weekend, and we'll see you next week.